topic of how to control the infectious disease, because we are saying the disease is spreading and it is causing a lot of damage to the community and the population and the because of epidemiology. So here I would like to speak about how to control the disease transmission or how to control the infectious diseases. How to control. So to control the infectious disease. So there are three methods are there. So already we have discussed infection spreading from one person to another person, and it is spreading by using of some carriers of flies or fingers or food or fluid. When we know from where infection is coming, if you know that, then if you take a measures, and definitely the spreading of infection is very easy also. Best example, COVID. Now the COVID has completely reduced. I will not say eradicated, it is reduced. How it is reduced means the government has taken lot of measures to control the disease transmission. So what kind of measures they have taken is, there are three possible methods are there to control the disease transmission or control the infectious disease. So that three things we are going to discuss. First step is how to control or where to control. We can say controlling the source of infection. Controlling the source of infection. So controlling the source of infection is from where infection is coming. Now during COVID time we came to know that the source of infection is maybe hands, or maybe because of the formats or the dresses, or maybe from the market, food, vegetables, everything. So what the government has done, from where the infection is spreading or who are the sources are there to transmit the disease, they stopped it, they blocked it, like they stopped complete open markets and open shopping malls or the large gatherings, functions, everything they have stopped. So means the function is the source of infection, means we have to cancel that function, then only the infection can be stopped. So that is the first one is we have to control the source of infection. And second one is blocking the channels of communication. Here channels of blocking, channels of transmission. This is the second one. Suppose you know that is through hands only it is spreading. Then during COVID time everybody said wear gloves, and maybe because of the sneezing only the major route of transmission through droplet only. So everybody must wear mask. So completely blocking the channels of transmission. Really they have done 100%, everybody should wear mask. I think even in some of the shopping malls also, still they are continuing the same methods. So that is blocking the channels of transmission. How it is transmitted? Is it transmitted through water? Is it transmitted through mosquitoes? We have to block it. So this is the thing is happening in all villages and especially in slum areas and the urban areas. The government is doing a complete sanitization of drainage system, and they do even mosquito sprays to control mosquito-borne diseases. So that is called as blocking the channels of transmission, which is causing transmission of disease, that we have to block it. And the third one is protecting the susceptible or risky individuals. Protecting the third one is protecting the susceptible individuals or risky individuals, we can say. You all know that who are all the risk population are there. So the risk population includes elderly patients, or the patients who are with different morbidities like diabetes, hypertension, all those, and the children below 5 years, they have less immunity power and there is a high risk of getting diseases, especially infectious diseases, very high. So that's why we have to protect the susceptible or risky individuals. That is the thing during COVID time. Everybody have done, like especially how to protect the children and how to protect the individuals, old age people, and who have certain kinds of illnesses. That is what the thing is happened. So there are three methods are there for controlling the infectious diseases. First one is first stop the source of infection, from where infection is spreading. Suppose think that through pigs only guinea worm is spreaded. Then they stopped controlling completely eating of pigs. Then once it is completely eradicated only, then they started again using of pork eating or all those things. And if you know that it is the diarrhea is due to contaminated water, we have to stop completely the source of infection. And second one is you have to change, because already I said agent, then environment and host. The three things only. The three things are not connected with each other. Automatically we can control the infectious disease. So channels of transmission, either direct transmission is there or indirect transmission is there. Is it due to mosquitoes? So what ways are there? We have to find out and we have to block it. And this thing really they have done during COVID time. Suppose the cases are coming from different countries to this country, then they stopped completely immigration processes for some months completely, so that they control the source of infection, at the same time they control the channels of transmission also. And the third one is protecting the susceptible risk. So when it comes to the controlling of source of infection, so the first one is, so I am telling you, just I am giving you a brief explanation of full topic. Just listen and write the exam directly. So the first one is early detection. Early detection of the cases. So where the cases, suppose one case is coming from China, then we have to detect. So is this person is carrying any disease. Second one is notification. We have to give that this case is suffering with so and so communicable disease and it can be spread to the community. We have to give notification to the health sector so that they can isolate or quarantine. Quarantine is a very familiar word for everyone now. Just isolating, keeping away from the common people and isolating the people to prevent the transmission of infection. So notification, and the third one is isolation. Already I have used the word. Third one is isolation, or we can say quarantine. Quarantine, separate. Then fourth one is after isolation, just leaving means patient will die, source of infection will not die. So what you have to do? You have to treatment, and the fourth one is what you have to do is surveillance. Surveillance means this is also very familiar word during COVID time. All A&M nurses gone to each and every house, individual houses, and they have checked anybody suffering with the disease or anybody still in the homes with certain symptoms. Constant observation of the presence of the disease. Surveillance is very important, especially for epidemics and endemics. Even in the pandemic time, everybody have done, healthcare professionals especially, surveillance they have done. And next one is we have to do the disinfection. I think this topic already we have discussed. How to control the source of infection means if the source of infection is through kerchief only, you have to disinfect by using of natural methods or physical methods or chemical methods. You have to disinfect, and then the source of infection will be stopped. So this is all about source of infection. Then next one we will see what are the channels of transmission. How to stop channels of transmission means blocking the channel. Suppose an individual only is causing the transmission from one country to another country. You stop migration process. You stop immigration process. Then the channels will be automatically stopped. It can be direct or indirect. Okay. So that is about blocking the channels of transmission. If you think that if infection is due to fingers or if infection is due to flies, then use fly controls. Then if it is maybe mosquito-borne diseases are high, then you have to take your measures for mosquito-borne diseases. Then next one is protecting the susceptible individuals. Who are these people are there? Then what you have to do is definitely immunization. Vaccination, you can say. Immunization is the first protective measure for the susceptible individuals who are risk. Then if you take, definitely automatically you can protect from your infections also. So immunization, and second one is health education. Help them not to get risk with this any diseases, and bringing awareness. Health education is the next one, which is helping for the protecting of susceptible individuals. These are the 3 steps. All government, either it is in abroad or in India, everybody is following the same 3 steps only for controlling the infectious diseases or communicable diseases. Okay, so this is about the controlling of disease transmission. Thank you for watching. If you really like my class, please do subscribe and share, and let somebody get benefited from my class. Thank you.